Okay, welcome everyone to our webinar today. It's our fourth of 5 webinars on, directed for implementers of artificial intelligence in healthcare. On the screen, you'll see that there's a poll that we'd like you to take. It helps us in understanding who's in the audience, and we'll can tune some of our comments to that. The second thing is you can see the links to our AI toolkit. There's also a QR code that will help maybe as you're going through this, and certainly an excellent reference, more detailed piece of material that you can use later on. And if we can move to the next slide, a couple of quick housekeeping items here. One is that this webinar will be recorded. So keep that in mind. There's a Q&A aspect in the Zoom that we'd like you to ask questions in, but sometimes people ask questions in the chat. So I think that's great. As I mentioned before, this is the fourth of five webinars that we had. An introduction to AI. We had a really interesting webinar on emerging regulations of AI in Canada and how it relates to healthcare. The session last week was about identifying strategic opportunities and investments in AI, and really about the approach of initiating or launching an AI solution project in your healthcare group. Today, a super interesting webinar on understanding the key risks of AI in healthcare. We'll cover topics like algorithmic bias, explainability, transparency, and a few other areas. And then March 3rd, next Thursday, was our wrap-up session. Likely the most interesting session that we've got of all of them. They're all interesting, but this one's my favorite. Don't forget to download the toolkit. There's a link and a QR code, and hopefully you also receive some of our pre-read information as we're going along. Next slide, please. If you would like a French interpretation, French translation, you should be able to click on the interpretation button on the Zoom recording. And one other comment on this: a lot of the information that we're providing feels like it's directional legal information. We're really just providing overall consulting advice to things that you might want to think about in terms of following up later. Next slide. Today we're going to have 2 presenters. Carol, who you've met before if you've attended other sessions. She's been instrumental in helping us design and package and deliver the toolkit. And then our next presenter will be Janet from Infoway's privacy group. She leads that group. She's also been quite instrumental in developing the content here. And I'm going to turn it over to Janet in 1 second. But if I could just get the results of the poll, and we'll have a quick look here. So lots of people who are just beginning to consider implementing an AI solution. And this is a core part of what we want to do. What we've put together from a content perspective within the webinars and within the toolkits proper is we're trying to provide some easy entrance points. And that's really what's in the toolkit and in the webinar. So I think there's a really good fit there. Also, we know that there are other people and organizations that have a great deal of experience in AI. I think there's things that you can pick up, and we're happy to have everybody. And without further ado, let me turn it over to Janet. Janet, take it away.
All right, good afternoon, everyone. Thank you so much for joining us today. And as we start, before we begin, and I wanted to provide an overview with regards to our primary focus. The whole toolkit helps to guide our understanding of moving from experimentation in AI to implementation. And so, as Brad had mentioned, there are different modules. In today's focus will be on number 2, and we're looking at we're going to be reviewing some of the main risks associated with the use of AI in healthcare and some of the strategies to mitigate those risks. The other questions that are asked and provided guidance on as it relates to AI looks at what does the law say about AI in healthcare in healthcare in Canada. And also, in the next section, it talks about how do I start experimenting with developing or adopting AI in my healthcare organization. So really that module will focus on identifying strategic opportunities, change management, AI policies, and procedures for good governance. Okay. And so again, as I said, the focus for today will be understanding key risks for AI in healthcare. And the target audience for this modules are those focused on risk and risk mitigation within their own healthcare organization. And the objective of this model is to really support critical thinking about AI risks and to understand some of the high-level issues associated with the development and the use of AI systems in healthcare. And the way in which we're laying this webinar is I'll take you through the first three risks that we've identified as some of the things that we should be considering when you're implementing AI technologies, and Kara will take you through the last three. So these risks include considering algorithmic bias, privacy, explainability, unintended consequences, security, and lack of regulatory clarity. Great. So the first risk that we will review is algorithmic bias, but we should understand that algorithms, what are algorithms? They provide decision makers with information, a forecast, a probability, or some other key unknown in order to improve the quality of decisions. So with the availability of mass data in healthcare, setting up algorithms for systems to perform a task has become more sophisticated. The ability for automated decision-making can introduce the risk of algorithmic bias, which is defined as the application of an algorithm that compounds existing inequalities in socioeconomic status, race, ethnic background, religion, gender, disability, or sexual orientation, and it amplifies inequities in health systems. If we think about it, prior to these algorithms, many of these decisions were made by people. Now, in the context of AI, organizations may start to rely on these systems or tools to help inform or influence their decision-making. So it will be important to assess the potential risk of creating algorithms that may have negative or discriminatory impacts on people in their healthcare journey. You might ask, why? Why does this occur? Algorithmic bias may occur because of inadequate data sets at the time it's collected, at the time of entry or cleaning, or in some cases when the data set is incomplete. And when this occurs, the output reflects that. The impact of this is real discriminatory outputs. And I'm going to briefly discuss a case with regards to an article that was published in 2019. And this was an article titled "Dissecting Racial Bias in an Algorithm Used to Manage the Health Populations." It was published in the Science Journal, and what it found was that algorithms commonly used by well-known healthcare providers in the United States exhibited significant racial biases. And so I think that this is a really good example of understanding the impact of using an algorithm and the impact was a result of, it resulted in discrimination against a particular group. So this significant study was, this was a significant study because it examined the use of algorithm, a prediction tool that by rough estimates was applied to 200 million people in the US every year. Large health systems and payers look to this algorithm to target high-risk management patients. So for these patients, they would be referred to programs that help to improve the care by providing additional resources. This was largely focused on improving outcomes while reducing costs. So a researcher named Zayed Obermeyer, he studies machine learning and healthcare management at the University of California. His team ran routine statistical checks on data they received from a large hospital. When running these statistical checks, they found that people who self-identified as Black were generally assigned to lower risk scores than equally sick white people. This meant that African-American people were less likely to refer to programs that provide more personalized care. The study identified a critical issue because the algorithm assigned to high-risk categories were on the basis of costs. The data showed that care provided to African-American costs an average of $1,800 less per year than care given to Caucasian patients with the same number of chronic health problems. The scientists speculated that potentially this difference in this cost is a lack of access to care for a number of reasons, particularly for African-Americans. In essence, because the algorithm assigned people to high-risk categories on the basis of cost, the biases were passed on, which resulted in African-Americans that had to be sicker than Caucasians before getting additional help. The study concluded that the algorithm was less likely to refer African-Americans who were equally sick to improve care for patients with complex outcomes. And so it was estimated this racial bias reduced the number. It ultimately meant that there was less money spent on one demographic population who had the same level of need. And so as a result, Obermeyer and his team then collaborated with the company to find variables other than healthcare costs that could be used to calculate a person's medical needs. And in doing so, it reduced the bias by 84%. So I think that one of the key points that this article highlighted is that these algorithms should always be compared to human decision-making to some extent. There must be some level of human intervention required to assess and evaluate the potential algorithmic biases within these tools and AI tools and systems. Okay, so the next slide. In terms of privacy, so what is the risk? Software using AI and machine learning in particular are often systems that are trained on large data sets containing personal information. Patient privacy concerns have been raised regarding the potential re-identification of an individual within these data sets. So we need to think carefully about the data sets that are used in order to build predictive models that are meant to improve diagnosis and better understand disease while ensuring that there is appropriate legislative authority to use the data for AI training purposes and to ensure data protection controls are in place. And why is this important? AI models have the capability to analyze, infer, predict aspects of an individual's behavior and interests. And AI systems can use such insights to make automated decisions about individuals. So what could be the impact? Failure to determine appropriate authority could result in violations of applicable privacy laws and significant reputational harm to the healthcare organization, as well as patient distrust. And so, as we discussed, machine learning is a method by which algorithms can be trained on how to recognize patterns within information and the ways in which data interrelate. One of the references in the toolkit points to a joint report by the British Columbia Information and Privacy Commissioner and the British Columbia Ombudsperson, and the Ombudsman and Privacy Commissioner of Yukon published a report titled "Getting Ahead of the Curve: Meeting the Challenges to Privacy and Fairness Arising from the Use of Artificial Intelligence in the Public Sector." I really strongly recommend you take the opportunity to read this report. It really provides useful information in terms of really understanding how to address what some of these privacy risks are and potential solutions. One of the things that I thought would be important to highlight is that the report it has called for a requirement for all public bodies to complete and submit an artificial intelligence fairness and privacy impact assessment for all existing and future AI programs for review by the relevant oversight body. Many of you in privacy are familiar with regards to the use of privacy impact assessments to assess risks. So in terms of what this report is recommending is completing an AI, artificial intelligence fairness and a privacy impact assessment. And so the report provides a discussion on adjusting compliance provisions and tools such that the government and private sector should be required to assess the privacy impacts before implementing AI technology. And this should be something that is ongoing and verifiable through proactive audits by regulators once the technology is deployed. One of the concerns that was also discussed in this report really talks about the importance of transparency. And, in talking about that, understanding how algorithms decisions are made, some of the key questions that were highlighted are understanding how algorithm decisions are made. Can the algorithmic decisions be explained, reviewed, or appealed? And be able to explain how biases are prevented. So as implementers, it will be important to consider incorporating the requirements of conducting an artificial AI FPIA in order to assess and mitigate the risks of AI technologies. And so one of the other points to consider would be taking a look at that publication. And also in the toolkit, we highlight some 5 privacy considerations for AI training and operationalization. Okay. And so in this slide here, we talk about some of the strategies for being able to preserve the privacy of data in these various systems and technologies. So remember, when we talk about AI, the learning often occurs within large data sets. And so one of the ways to address these concerns is to either use synthetic data that capture as many of the complexities of the original data, but that does not include any real patient data. So synthetic data is the use of fake data that is modeled from original data sets. While it can capture many characteristics of the original data set, it does not include any real patient data. Research demonstrates that it can be as good or even better for training an AI model than data based on actual objects, events, or people. So in a June 2021 report on synthetic data, Gartner predicted that by 2030, most of the data used in AI will be artificially generated by rules, statistical models, simulations, or other techniques. Another method for helping to address the privacy concerns with regards to AI technologies is this concept called federated learning. So essentially, federated learning is a technique used to train algorithms by using multiple data sets without having to actually exchange the data. So think about it more of a decentralized model for where the data is being held. Portions of machine learning are trained where the data is located. No data moves within the system, which means that organizations can still collaborate without compromising private and sensitive data or some of the risks associated with transferring data. So federated learning can also help address some of the challenges related to data privacy and data governance by enabling machine learning models from non-co-located data to apply. Federated learning also promotes accessing data on site without moving or copying the data. Okay. And so, in terms of the last risk on explainability, this one talks about one of the potential risks about using AI is that AI systems can be very difficult or impossible to interpret or explain, leading to black box technologies. And so what is the risk? AI systems, what's the impact of this? Again, similar to the impacts that we've discussed before, it can produce some discriminatory or harmful outputs, okay? And there is guidance on what an explanation ought to look like or contain, but in terms of just being able to explain the AI or machine learning technologies. So 1, a description of how the system is used. 2, some of the reasons, factors, and parameters that led to that decision. Details about the personal information that was used to generate the decision, and all explanations need to be clear and understandable language that is accessible by all affected individuals. And so I thought it was important to highlight, explainability is necessary for several reasons. 1, it helps end users of the system to understand the system outputs, and which will help to inform their own decision-making, helps to investigate anomalies or detect false positives, helps to provide confidence in the outputs of the AI system, and encourage adoption and trust if the key stakeholders understand the system outputs. I thought it would take, a minute here just to share my own experience. I previously worked in a healthcare hospital setting in which I implemented an AI tool, and it was a medium-sized hospital, and what the tool was to, it was an auditing tool to be able to detect, monitor compliance for potential inappropriate access to the health record. And as you can imagine, the challenge of auditing patient records for inappropriate access was difficult because it often felt like you were looking for a needle in the haystack in some cases, given the vast amounts of transactions that were occurring. So in this role, I investigated an auditing solution that had machine learning technology. And this was a completely different approach because it helped to highlight the high-risk behavior by essentially filtering accesses and identifying the high-risk accesses for my particular review. And essentially what it did was it brought to the forefront the accesses that were potentially unexplained. So if an end user looked at a record that could not be explained based on a logic behind in the system, that would be one that would be brought to the forefront for my attention to review. And I'm only bringing this as an example because I thought this would tie in really nicely in terms of the importance of ensuring that the logic, the outputs of those audit reports were explainable, that I was able to really help to provide confidence in the system, would also help to detect any anomalies, and also to make sure that, when I'm looking at the outputs of these reports, that they were explainable. And so, that just very small in this small segment just really touches upon my own personal experience with regards to AI, some of the privacy risks, and some of the current concerns that I've mentioned earlier. Truthfully, if I had this toolkit at the time I implemented, it would help to guide my decision-making along the way. And so with that, I can hand it over now to Carol.
Thank you so much. I think that was incredibly informative in articulating some of those key risks that we see with the implementation of artificial intelligence systems and really contextualizing that when we think about the overall toolkit. So we started by identifying what is artificial intelligence? What does it look like? It's a very broad umbrella term. And how is it being used in healthcare? So we did talk about at the beginning, module 1, the fact that artificial intelligence was being used not only in administrative functions to promote systemic efficiencies, but also that it was being used in clinical functions. So potentially to support clinical decision making or facilitate a better patient outcome. And so when we take that in context and we unpack what it means to be an AI system, even using that umbrella term, we've looked throughout the toolkit at the importance of your data analysis. And I thought Janet's summary of some of the privacy concerns are particularly valuable here. So we have major data play on the outset for that group. I think it was 69% of our audience today that has very little knowledge of how to implement artificial intelligence within their setting. Well, we've always talked about, we start with that data analysis. So what data do we have? How are we going to use it? What authorities do we have over that data? Where is it located? That really ties to Janet's point of the federated learning model. Do we need it in a warehouse, which we often talk about, or can we use a federated decentralized model to access the insights from that data? So really undertaking that profound data analysis is so important. But then as you work through your planning and you identify the key players that need to be at the table to talk about what artificial intelligence technologies might be used to address some of those pain points that exist within the organization, really touching on module 3. We find that, we need to be thinking about systemic considerations as well. So considerations of explainability and what I would like to speak to you about, which includes considerations of unintended consequences. So what do we mean by unintended consequences, and why is that the case? Well, when we're looking at artificial intelligence systems, go back to that module 1 when we were defining it. It's a computer system that is intended to be learning from the data environment in which it's situated. And in so doing, it does change over time, or has the potential to change over time, depending on if it's an open system, to new data information, or new data sources. And that may change the intended purpose of the system, or it may be used in a manner that changes the intended purpose of the system, or through interactions with various stakeholders or users of that system. The purpose may ultimately be impacted and may change. And as a result, since you have a learning system, a learning computer system, you have the potential that what you initially as a developer, what was initially intended may change over time, or that the output is not exactly what you expected. And so that really touches on some of the critical features we find around unintended consequences and the importance of trying to forecast what those potentially could be and taking measures to mitigate those potential damages so that individuals or systems aren't ultimately harmed, particularly given Janet's last point of explainability, where these systems can be so complicated to unpack and understand that the layperson will really struggle in deciphering what is a strength or weakness of a particular output and whether that output is associated with the intended purpose. Meaning it can be really easy for an unintended consequence to go unnoticed, particularly when you're looking at systemic functions. So the impact can be quite severe in some cases, depending on the nature of the system that you're using, the context, obviously. It could have an impact on patients, on patient outcomes, absolutely. Janet gave an excellent example of how, I don't want to say ill-configured data set, but a data set was used to train a particular system, and then that system was used in a manner that was harmful to individuals. There wasn't enough rigor clearly around, or perhaps awareness around, how the data set had a biased output, because it in and of itself was representative of a very specific group. So there wasn't enough rigor and sort of diligence around how that data set would ultimately would flow through the system to a potentially harmful output, leading to, in that case, a discriminatory outcome, certainly unintended in that sense. So it can have a profound impact on individuals and individual patients, in that case being denied particular services and improperly being triaged. Other unintended consequences can be much bigger. We saw just a few years ago outside the healthcare context where a self-driving car misidentified an image, mislabeled an image, and ultimately hit a pedestrian. So really tragic unintended consequences. All to say that there's a degree of rigor, and we're going to look at this in the sixth point. But there is a degree of rigor and diligence that not only healthcare organizations, AI developers, users, or impacted stakeholders of artificial intelligence need to be thinking about, but also what regulators are thinking about. So what is this technology? How is it evolving? How is it being used? What are the potential harms? And what could potentially be done to mitigate those harms? Again, Janet referenced an excellent paper from the Privacy Commissioner in BC, Ombudsperson in Yukon, that was calling for an algorithmic impact assessment as one mechanism to think through those potentially foreseeable harms and then take action to mitigate. So when you're looking at your matrix of risk, certainly consider what are some of those potentially unintended consequences, and work with your multidisciplinary team that we covered in the last webinar. Really work with each other to think this through, because this isn't a one-person endeavor. You really need a team to think through what the potential consequences could be and why, based on the data that is being used to train the system, the nature of the system, and the nature of the context in which the system is being used. Another issue that is incredibly important is that of security. So when we're talking about security of systems, we're talking about the potential that there could be an adversarial attack on the system that ultimately changes the output. For instance, a system like a computer vision system that labels images may be used in a number of different healthcare contexts, including in the interpretation or analysis of ultrasound or X-ray or CT scan images, any diagnostic image. Where there's an adversarial attack, the attacker may intentionally go in and obfuscate some of those images to confuse the system, thereby impacting accuracy of the output, reliability of the output. Again, because these are such complex systems, it may be difficult for the end user, or particularly the end user in this case, to understand that there has been a type of attack and to know how to change or what to do to try to mitigate that harm. So the security components, again, we're going to find this is not just an important consideration in your risk matrix. So thinking very practically, how do I start implementing? How do I start planning for ideas and execution of various AI systems? But it also helps you think about who needs to be around the table as we plan out some of these strategies. Your security team is going to need to be there. In addition to that, as Janet had mentioned, again, very thoughtfully, these systems rely on huge data sets. And so the protection of that data, particularly where it's being, they're being consolidated and centralized, protection of that data is incredibly important from a regulatory perspective, from a reputational perspective, from a trust perspective. So thinking through the two aspects of data protection and of AI security, the one being the data that you're actually using to train the system, and then the second being the integrity of the system itself, such that it's not being attacked and that it is well preserved. The example that we give is in the context of software as a medical device. in cases where medical devices, the actual device, the hardware itself, it relies upon AI-enabled software to the extent that that software is responding, reacting, and learning from its data environment. We wouldn't ever want to have a type of adversarial attack on that system that ultimately has a direct and immediate impact on patients. So something to be very conscious of and to work with the security team. We're engaging a vendor, making sure that you ask your vendor a number of questions regarding the security of their systems and the security of their data warehouses. Finally, there is right now, I would say a lack of regulatory clarity around artificial intelligence, but that's quickly changing. So even since publishing this toolkit, there have been a number of international and national regulatory initiatives that continue to clarify what the regulatory landscape for artificial intelligence is going to look like. And the reason I say this is because we not only have now sort of draft legislation out of the European Union in the form of the Draft Artificial Intelligence Act that is actually quite prescriptive about what is considered to be an appropriate, like a high risk environment or a high risk AI system, and then what are the appropriate prescriptive measures that ought to be put in place either by the vendor, or I shouldn't say either, by the vendor and by the purchaser, by the user of the system, to reduce associated harms and to ensure as much as possible that the system is being used in accordance with the intended purpose, as well as to further societal values as opposed to potentially subvert those values. So we've got some guidance out of the EU that has been building over years. And if you have the interest in reading that draft law, really spend a few minutes on the preamble, because that background context will show you how much work has gone into the draft Artificial Intelligence Act draft law. Now, whether you agree with the way it's been drafted or not, doesn't matter. What's interesting is just the nature of the topics that were covered, the nature of the advice and the guidance that is being provided, and then noticing the importance of the impact assessment. So like BC, Yukon, like the OPC, the Office of the Privacy Commissioner federally, what we have also seen in draft law in Canada to reform the Canada's private sector privacy law. All those different Canadian jurisdictions are also calling for impact assessments of AI systems. We are also seeing that in the context of the EU, and the recently tabled earlier this month, the Algorithmic Accountability Act in the US has been retabled. It was tabled first in 2019, now again in 2022. Also calling for an appropriate and robust impact assessment conducted on AI systems before they're used, and importantly, throughout the life cycle of the AI system. So there is absolutely regulatory, sort of lack of regulatory clarity as we start to take shape and really understand the potential harms associated with AI, as well as really appreciate the potential benefits so that we don't lose sight of the potential benefits. But increasingly, and actually quite rapidly, the clarity that we are all searching for is coming into effect. And we're starting to see, for instance, an focus on explainability, transparency, accountability, privacy, impact assessments, an iterative process. You don't just do it at a point in time, but it is an iterative process throughout the life cycle of the AI system, professionalism by those who develop these systems, and a degree of training and understanding by all those who have to interact and use these systems. So really things are starting to change, which is great for our 69% of the audience that are just coming to this now, because there is so much to learn. And the toolkit really does provide that overview of key questions that you need to be asking, key individuals you need to draw from, some examples and ideas of how to organize, and then ultimately some guidance in terms of where we can spend time implementing different initiatives, different training modules that are really important, particularly in the early stages, the change management process that is needed to go from more of a legacy institution to a digital first institution and AI enabled institution. And then what we'll cover in the next module next week will be exactly the nature of the governance strategy that you may be putting in place and specific guidance around what that looks like. So today's webinar has really focused on some of those key risks to help you identify and draw out your own risk matrix, your own risk framework, and also to help you really think through, who are the players in my organization that need to sit around the table to help me devise and plan our AI strategy. I always struggle when I use the term AI strategy because, as we said in an earlier webinar, the point is not to use artificial intelligence for artificial intelligence sake. Absolutely not. It is really to enable and support, augment the talents that you have within your organization and allow each individual to really play to their highest value. So the lower value skills or the lower value tasks or activities can be potentially, outsourced, if you will, to an AI system. And that allows your organization to really focus on high value activities for the organization itself and for those really important stakeholders like your patients. The change management process throughout all of this is also extremely important. If you've attended our webinars before, you've heard me talk about that. Getting that element of digital literacy right front and center, getting senior level buy-in, incredibly important. Establishing those experimentation sandboxes, if you will, is also critical for really ultimately establishing or proving success. And then being thoughtful about what that risk matrix looks like so you can speak to it intelligently. When there are questions that come up, you've already thought it through, you're working on it, identifying those benefits to continue to, give that excitement around how these systems can be beneficial to the community in which you serve. All really important elements to your overall AI strategy, your overall or digital transformation strategy. That might be a more appropriate term for your organization. I also want to remind you of one more thing before we open it for questions. And that is the points that we were talking about during the last webinar. So if you weren't able to attend, I would encourage you to go back and access the webinar. I think it's on the Infoway site, because something we talked about that's super important when you're thinking about this risk matrix is, who is my organization? Like, what is the risk appetite associated with my organization? Are we the early adopters? Are we the front runners when it comes to technology? Or are we the late adopters? We'd rather have it tried, tested, and true before we start to pick up anything new. And one is not better than the other. There's no judgment as to whether you're an early adopter or a late adopter. It doesn't matter. It really is just understanding the flavor of your organization so that when you do speak to some of these risks and you think through these risks, you do so in a context that really understands the narrative of your organization and the community that you serve, so that you can connect those dots for people sitting around the table, particularly the senior executive team that needs to buy into the risk classification or the risk spectrum of some of your ideas, as well as make those important investments that are needed in order to ultimately be successful. We did look at one case study out of Newfoundland and Labrador last week that touched on the virtual assistant, an AI-enabled virtual assistant for internal supports to staff at Eastern Health to identify mental health resources that were available to them. And one of the points that was made at the time was this particular system was very valuable. It continues to be used, but it did need more investment than what was initially intended. So having that buy-in at the senior level was incredibly important to see it through to success in the end. So I'm going to close there, Brad. I'll turn it over to you for some questions, and to really engage the audience. I see there are a number of comments in the chat.
Right. Thanks a lot, Carol and Janet. So interesting as usual. So we do have a couple questions. Carol, I'm going to put you up first, and Janet, you'll be on second, and then we'll just take it from there. One of the things we did in the toolkit when we looked at topics like algorithmic bias or data bias, we constructed checklists and approaches that I think were generally useful with lots of different personas. You know, if you were in procurement, what might you want to ask a supplier about their data? If you were a healthcare professional talking to your patient about how an AI solution helped make a recommendation about how to move forward. If you were a data scientist trying to figure this out, could you just talk about how multiple groups could use the same types of checklists to kind of come up with a conclusion on it? And I just picked the algorithmic bias and data bias. That's some of the questions that are coming up there.
Absolutely. I mean, this also speaks to the point of the impact assessment and how you sit around and not only plan out what your experimentation portfolio will look like. I always struggle with what is the proper term to describe this, but it's as you go through the entire life cycle. So let me just back up for 1 minute before I get to the heart of your question. When we initiated this toolkit, it was already COVID, okay? We were already at home. And something that has been very interesting in the last 2 years is the degree to which we have accelerated that digital transformation. So it was, I think, very astutely put by one of our startup founders right at the beginning of 2020, I guess March 2020, as we were all sent home, where he said, 2030 has just been accelerated into 2020. And so here we are finding ourselves in the 2030 world 10 years earlier than we expected because we've all been sent home. And so this digital transformation has been rapidly accelerated, not especially, I would say, in the health sector, where the intersection of health and tech could not have become more prominent than during COVID. So I say that because you will start, for the 69% in the audience that are very new to this topic, you will start to feel those pressures, or you will start to be that change leader within your organization. And you will get much more support than you would have in 2019 because that digital transformation has occurred so quickly, and the pressures around digitization and sort of virtual access to everything and the use of technology and data has accelerated as well. So I say that as context because when you think about the various tools that are available throughout the toolkit in particular, the most important point that we keep making time and again is that this is not a unilateral endeavor. You work in multidisciplinary teams to look at the particular context from different angles. And as you do that, even when you're using some of the checklists that are available that we'll talk about in the next webinar, you know, they're really designed to be able to facilitate that multidisciplinary discussion and to speak to different audiences so that the toolkit can be valuable and can facilitate, I hope, a more targeted and tailored strategy for any organization. Janet gave us the example of her own organization that was sort of a mid-sized regional hospital, and how, you know, even at that stage, they're starting to use artificial intelligence and could have really benefited from some maybe more directed guidance around, you know, what do we need to look out for? How do we need to plan? How do we need to report? Who do we need to convince? What does success look like for us? Really important strategic questions from beginning to end as you go through that process. So I think, you know, just to then, you know, wrap up my part of this answer, that the checklist at the, particularly in the last, that we'll cover next week, those are intended to be guidance. They can be tailored, and they should be tailored to your organization, and they should be used as a purpose for discussion, to sit down in some of those multidisciplinary groups and really talk about, what does this look like for us? How can we adapt it to our circumstances? How are we going to actually do this? What is it going to look like to implement?
Thanks, Carol, and thanks for a pitch for next week's session as well. So, a question for Janet, and I'll just build off of what Carol talked about. You and your institution were fairly early in the cycle of implementing an AI solution, and I bet sometimes a little bit lonely. You're trying to find out where the guardrails were. Could you just talk about things that you've learned and lessons, and how you might look at it a little differently now you know a little bit more?
For sure. So I have to emphasize, I think Carol's point around the multidisciplinary department, the discussion that happened, for sure. I think one of the key things was, in particular, as I mentioned, I was looking at an auditing tool, right? And so, at that time, the hospital, they had one, right? And so the question would be, why invest in this one? What would, why invest and change management processes, all types of things. And so I think what was really important there was to, what I learned through this toolkit was really having to have a structure around, I'm going to call it a template. It's not a template, but really a roadmap for us to look at how to understand what are some of the ways in which we need to have the discussions and with who and when. So in my own project, one of the key things was, having discussions with, the physician leads, HR, IT, within our own risk and quality and privacy departments, because if you can imagine, they're having an AI tool within an organization that was not well understood at that time. It was really important to ensure that they could trust and really verify the outputs of the reports that were being generated. So these are real people who are accessing real patient information using a real data set. And so I think that one of the key learnings in my view was to, going back to this, is being able to more tangibly discuss some of those risks in a way that was meaningful to them and what it meant to them, in their own roles. Also, I think that this also helped me to really, and I think there's a point in our chat that talk about risk tolerance. That's a really, really important point to raise, because to what extent, were we thinking about, the appetite of risk for, adopting this AI technology? It was the first one in Ontario, first one at the hospital, second one, I believe, in Ontario. And so it was something very new that in a time period in which, the hospitals at that time were really being, the focus was ensuring that you had appropriate controls in place to prevent inappropriate access. So, there's a lot of thoughts there, but, there was a lot of opportunity, I think, in being, participating in the development of this toolkit and discussions is really thinking about, how do we, provide some practical guidance that you can take back to your organizations to start thinking about as you begin your journey in AI.
That's great, Janet. Carol, what are your thoughts on this?
So I want to talk about, I see there's a comment that I want to dovetail with Janet's around, what are some of those practical strategies? What does that even look like? And I want to propose a few ideas. So the first is starting to actually identify some of that, do some of the hard data work, understand who are the main leaders, who are the main drivers of that or custodians of that data, not in the health privacy sense, but more in the organizational sense. Sitting down to really understand, what do they have? What does it look like? Who are they interacting with? And then getting that buy-in by presenting on the potential of artificial intelligence to the senior leadership team and articulating what that potentially, I don't want to say overall strategy or enterprise strategy, because it feels too big. It might even just be what our experiment strategy is going to look like, right? So we now know that organizations like Canada Health, Infoway, and lots of others are coming forward to demonstrate the value of artificial intelligence in the health sector for our organization and for potentially our patients. So what could we do to, again, allow some of our people to really play to their highest value and not have to do some of those smaller administrative tasks that they may not be as interested in doing? And that might be right for AI as an initial investment. I think when you start there, you can make a pretty strong pitch for why some resources are valuable and beneficial, and why an overall strategy will be needed, and what it would look like to start to build out that overall strategy. So I think going through the toolkit from beginning to end will definitely give those ideas. But really what we're, if I had to summarize it, I would say we're going to be looking at, as you're making that pitch to senior management, the questions they're going to be asking is, okay, well, who's involved? What are the resources look like? Why are we doing this? And what are the potential risks associated with this? And I think you can now start to answer each of those questions. After today, you can certainly start to answer what are some of the risks associated with these systems, but also the fact that there are tools that we can use, like impact assessments, to help mitigate some of those risks. And these tools are not new to the health sector at all. Privacy impact assessments are done all the time in the health sector. So the fact that we would add, of course, it's different. An algorithmic impact assessment is different, but the sort of muscles you need to exercise to get there, we already have. It's now learning a little bit of new content. So I think that's a really important point when you're talking about getting the leadership buy-in. Also, it's doing that sort of literacy training work that's incredibly important and often considered to be, a end stage type investment. It's something that should be done upfront. Get people to come into your organization or present within your organization. Start with, here's what artificial intelligence is. Here are the benefits. Here are the risks. You can look at module 1, module 2, and module 3 of our webinar series and of the actual toolkit to just give you the content you need for that initial literacy training. That should be more than enough. So I would start there as well.
Thanks, Carol. And I think that partially also answered the question, Jonas's second question on leadership. Jonas, we also had a session last week on your organization's readiness for implementing a solution. There's some good information there, but it's also an opportune time for me to mention that we're also thinking about the best way to capture the questions that we couldn't answer during all of our sessions. We always have a couple of overflow ones. I have one more question for Carol. It's likely a really interesting answer. I'm really intrigued to see how you're going to answer this. It comes from Robert. Can you comment on the liability issues when there is an identified unintended consequence? Who actually is liable? Clinical, hospital, vendor, who? And Carol, you're just giving us a little bit of non-specific legal advice right now, but how would you begin to triage that type of question?
Yeah, so I'll stay clear of legal advice, but I will give that sort of guidance on how to think this through. So when we're talking about right now, the question of liability is super interesting because you look at it from different angles. The first thing you're going to look at, what do our contracts say? Okay, so if it's a vendor relationship. So if you have procured an AI system or you're working with a partner, you're going to look at your partnership agreement or your partnership, maybe it's a co-ownership agreement, whatever it may be, a joint IP agreement. You're going to look to the terms of that agreement to see where was liability allocated. So that's answering the question of, how is liability determined as opposed to how should liability be determined, which is a much broader question. But the first thing you're going to do in answering the how is liability allocated, you're going to look at the contracts. Because right now, the world of liability for AI systems is contractually bound. So it very much is in that, it's determined by those contracts, or where it's something that's done internally, we still apply sort of traditional diligence analysis, because what we're looking at is, did you do this? Did you develop the system in a responsible and diligent manner? Did you have sufficient oversight? Was there a human in the loop, meaning somebody who is properly qualified to serve as that middle person between the output of the AI system and the sort of impact on affected individuals? Is that training sufficient? So the liability question really, it's huge because it does depend on what the nature of the circumstances are. But where it's also becoming quite interesting is recent discussions by medical associations around how artificial intelligence is going to change or affect the standard of care for physicians practicing, or for any healthcare professional practicing, where they may be relying on AI systems for diagnostic purposes, or they're not, but arguably should be. So we don't have clear guidance on that yet, but we have a degree of precedent if we look at other technologies such as x-rays or ultrasound machines, for instance, that were never part of the standard of care in the 1950s. And then as they became more reliable, more accurate, more accepted, and then ultimately more widely used, were ultimately embedded into that, professional liability analysis for a medical malpractice lawsuit, for instance, where if a physician was trying to diagnose, I don't know, like a appendix, and they, in 2010, and didn't do an ultrasound imaging of the patient at, a critical juncture, then that would be considered falling below the standard of care. They didn't use the technology that was available to them to have a more accurate diagnosis. So I think we're going to see that starting to happen in the world of artificial intelligence as well, where if we're not using AI systems in certain contexts where the system has been verified, it has demonstrated that it is consistently reliable, consistently accurate, and a physician isn't using it to double check his or her own judgment, then it may be that over time that's considered to be falling below the standard of care.
Well, thanks, Carol. Again, a lot of work to do in that space. I think we're going to wrap up now. I want to thank Carol and Janet for their time today, and for everyone for attending. Don't forget that there's a toolkit to download, and look forward to seeing you next Thursday from 12 to 1 on governance. Thanks a lot, everybody. Bye-bye.